Hi, good evening, guys, and good morning. If you're in United States of America, good evening, and in Philippines, magandang umaga. In United Arab Emirates and to all my friends in Kingdom of Saudi Arabia, salam alaikum, everyone. It's me, Dr. Jenny Yusuf, physical therapist and doctor of physical therapy, creator founder of Balance and Pulse Support Group, and Physigen PT and Wellness. I'm the current vice chairman of the Academy of Physical Therapy Association's Global Health and Aging Adults, SIG, Special Interest Group. So tonight for our Balance and Pulse Support Group podcast, we have Dr. Ulysses Juntilla. He is a physical therapist, doctor of physical therapies, and also an orthopedic clinical specialist and also a fellow of the American Academy of Orthopedic Manual Physical Therapy. And he is a creator and founder of the Philippines Academy. What do we call that again?
Philippine Association of
Philippine
Orthopedic Manual
Association.
Physical
Yeah.
Therapists. Mm.
So the Philippine Association of the Orthopedic Manual Physical Therapy. So he is the creator, the founder, and the previous president of that. So we will learn more about that, how his transition in this career, and he's currently right now in Columbia, South Carolina, working as a full-time physical therapist and doctor of physical therapy in Veterans Affairs. He's a clinical educator of the residencies there, teaching some students, and also a educator in his wonderful Facebook group and Ulysses Juntilla PPDPT. All right, to get to know more about him, Dr. Yule, welcome to Balance and Pulse Support Group. How are you?
Hey, Dr. Jen. Hello, good guys. Good morning, the Philippines, and good evening in the US. I'm doing well, and thank you so much for this opportunity.
Yes, you are welcome. We are so glad that you're able to make it tonight. I know you're very busy. So, you are almost like 15 years in America working in Veterans Affairs. You have wonderful and awesome credentials. So, tell us more.
Thank you.
What's the passion? You're welcome. What's the passion of going in orthopedic um, expertise or specialty?
Yeah. So since I came, I've always been inclined to musculoskeletal problems with patients. When I first came, my working with the VA, we always have musculoskeletal issues, spinal pain particularly, like neck pain and low back pain. And so uh, for me during that time, it seems like I'm missing with something that I need to really know how to manage these people and become effective in my treatment approaches. So that's why my passion has started to grow. I got my transitional DPT to know more farther in physical therapy because when I was in the Philippines before coming here, I was actually not practicing there. I was teaching. I was an educator back home. So I never had a chance to be in clinics. So when I came here, I felt like I had more like books information rather than clinical informations. So I
Yeah.
did that and then did my specialist exams for OCS, and then ultimately went to fellowship in orthopedic manual PT.
Wow, that's amazing. Can you tell us more? We have many, I met many different occupational, let me see, orthopedic clinical specialists. I met
Mhm.
majority of them, but being a fellow is a really different degree. Can you tell us more? What is the job description? What is the mission and vision of being a fellow?
Yes. My the fellowship is actually under the American Academy of Orthopedic Manual Physical Therapists. It is a subspecialty in orthopedics. So a lot of times they want to pattern it like in a medical like specialty. After a residency program, you got your specialty boards, and then after that you do your subspecialty doing some fellowships. So I did follow that steps. I did, although my OCS or orthopedic specialty was not through residency program, it's through number of hours, and then you'll be eligible to sit. But after that one, during that time, there was a requirement to get the fellowship training. It's a whole year program focusing on orthopedic manual physical therapy. It's more the practice is more on a description of subspecialty practice So there are different dimensions that a OMPT should be able to know, and it is guided by the policies or standards with the International Federation of Orthopedic Manual PT worldwide. So
Wow.
there are countries around the world, from Canada to US to Australia, UK, with the same standard.
Wow, that's amazing. And now also because of that, you being a fellow, you want to bring that kind of standards in Philippines. That's why you're the founder of the Philippine Association of Orthopedic Manual Physical Therapy. So tell us more about how's the transition and also how's the experience of being a founder and how is it?
Yes.
Especially it's very new. For me, I'm more in geriatrics, and where I'm learning more and more people in PAOMPT. We have Dr. Lily Bautista and also Kai Jose, now you, and I will learn more about more people. So tell us more, what is the PAOMPT or
Yes.
Philippine Orthopedic?
So definitely. So um, in 2000, 6 years ago, there were six of us who founded PAOMPT in the Philippines. One being Andre Altavaz. I don't know if you know Andre, based down in Florida. And then we have Lawrence Sormiscal, one of the professor there in Augusta University. And we are fellows, and then we thought that we want to lift up the standards of specialty practice in the Philippines, and there's no like organized group yet to have started the OMPT subspecialty. So we decided to create one, of course, by the blessings of the PPTA. I'm very glad with Mike Gabilo, who is very supportive with our plans and our mission and the vision. So ultimately, we actually successfully had 4 national conferences in the
Wow.
Philippines, annual conferences. During my last, prior to the pandemic, I had a chance to go first time to, to speak for the national conference, and I invited some local U.S. OMPT specialists there too.
Mhm.
And at the moment, after my 6 years time to build the association, it's time to endorse. So now Dr. Lily Bautista is now the president
Okay. All right.
AM
That's
back
why.
home. Yeah, and then this is our goal and mission to hopefully get the member status for the IFOM, so that the American AOMT, where I am a fellow with, and the Philippine PAOMT has the same standard of training. That's actually the goal.
Oh, wow. That's really a great transition
Yeah.
there. And thank you for bringing it to Philippines so that majority of our physical therapists knows their specialty and been
Yes.
exposed with the wonderful evidence base of musculoskeletal as well in treatment in their cases. So
Mhm.
why do you think, Dr. Yule, evidence-based things are very, very important, research based in treating and managing our different cases?
I think it's not just in musculoskeletal
Oh yeah,
care. In,
of
in, in
course.
physical therapy as a
Mm-hmm.
whole, evidence-based practice is very important, because that's how we can be able to change life for our patients. We're able to treat them effectively and efficiently. Let's say, for instance, in our old ways, we treat them for 20 times, and they're still with hot packs and ultrasound. And now we're able to, like for instance, in my case, before I've never have treated headaches, and actually that's one of my specialty right now. I depends upon the complexity. Sometimes 6, 7 treatments, headaches significantly had significant difference of change. So that's very important, and probably that should be a factor of change among our clinicians to be able to apply evidence-based practice.
Yeah, that's wonderful. I even have one case right now. She just had a TIA.
Oh.
Yeah, but I said, and she told me that she just had finished prior to her having a TIA because I'm
Mhm.
home health. And prior
Mm.
to her TIA, she is having an outpatient because of her cervical neck injuries coming from
Mm.
an MBA.
Mm.
So she was surprised that the doctor just refer her to physical therapy and not doing any MRI. So I
Mm.
explained to her that That's the benefits of being a physical I salute that doctor who did that to you.
That's right.
I
Yeah.
even told that because we really made more respect for referring to physical therapists first rather than doing, let's say, MRI just right there and then, because that's very expensive. And
Yeah.
what can you tell us more about that kind of routine? Why physical therapy is important and exercise is important versus more on going first to imaging?
Yeah. So a new approach now of evidence-based practice have noted that these imaging is actually not necessary. So I am a big advocate on this one. As a matter of fact, in my practice here, I'm one of the clinician who have like what we call as cooperation with or association with the primary care. We have primary care. We educate our primary care that imaging is actually not necessary, and we give them evidence because some of the primary care are so busy in their daily practice that sometimes they forget this specific protocol and
Yes.
so on.
Also.
So we give them like quick brochure or something like that even if you do neck MRI, the management doesn't change, and it will sometimes add anxiety to patients. Like after they get the results, they have like supposedly it's actually not the cause of pain, spondylosis, degenerative disc, and now they're like, oh, I actually have degenerative disc that causes the pain, and so it increases their anxiety, fear avoidance, and sometimes catastrophizations that uh, leads to reduction or poor outcome in rehabilitation.
Yeah, that's really good. I always believe that proper education with the
Mhm.
clients are the best treatment that we can offer.
Definitely.
If our patients are being educated, there will
Mhm.
be a better compliance and there will be a less anxiety, as you explained,
Yeah.
Dr. Yul. And then also there will be more understanding. And I like those referred pain.
Mhm.
Sometimes they have the neck pain and then they have this weakness on their arms, and
Yeah.
then you will see that where it's exactly coming from.
Yeah.
So we, as a physical therapist, occupational therapist, we are movement experts. So
Mhm.
if you are listening, guys, because our listeners are also clients and caregivers itself, if you
Mhm.
have a back pain and then you have a neck pain, sometimes it's not really on the back itself. It's like anatomy train, we call it, like coming from the foot or ankle. That's why you are having a hip pain. How
Mhm.
do you walk? That's why check with them. And we can really give you some ideas, give you some tips on how to manage it well. Because doctor, you remember, if we don't correct the problem, the pain will keep coming back and because it's not been fixed, right?
Yeah, and then in addition to going back into imaging, sometimes we do recommend imaging as long as there are presence of red flags. So we always
Okay.
tell imaging to the low back is necessary if there is progressive neurologic deficits or let's say sign of cauda equina syndrome, or neck if signs of myelopathy. But otherwise, if it's just general acute pain or chronic pain conditions in the spine, uh, we have to try physical therapy first without unnecessary expenses through those expensive imaging studies.
Yes, that's really wonderful. Then later on, they will learn from the movement expert, physical therapist, and all the different wonderful exercises and modification they can
Yeah.
do. Imagine sometimes job ergonomics is only the key, and then that I have a friend here. She knows I'm physical therapist. She's my neighbor in the area, and then she asked me, Jenny, she knows her diagnosis because
Yeah.
she's been in an outpatient. Jenny, I
Mhm.
have a sciatica. Oh, sciatica. Imagine from she knows her sciatica. Okay, so what's your symptoms if you have sciatica? All right. So she said, I have pain here on my bottom. And then it referred to is the referral pain. So I explained, yeah. So, okay, I asked a few questions. So are you putting just typical book, the book
Yeah.
review that we have? Do you put wallet in your in your pants, something like
Yeah.
that? I remember that during college. And then said, so oh yeah, I always put up what do you call the wallet in my back pants,
The
and
area.
then
Yeah.
try to remove the wallet, try to put it in your purse or at the front, or refrain from wearing tight pants. and then do some stretching a little bit like this and like that.
Yeah.
And then after that, she's so happy that I was able to relieve. And every time she saw me, she's thinking, oh, she's the one who relieved my sciatica. So just
Oh,
education, right?
definitely.
Changing a simple thing that you keep doing as a habit might be the key. So always
Yeah.
connect with your physical therapist, guys. Check with your primary care physician if you have those symptoms. Dr. Yul, I have a question regarding your what's your challenges? Veterans appears a little bit I know a challenging practice. We have many our veterans a little bit with some mood behaviors. They're a little bit strict. They have PTSD. So what are those cases that you encounter or challenges that you're able to make it up?
Yeah. So for the last 16 years, or yeah, 15, 16 years with the VA, I'm very honored to have served also our heroes who have served. And there are challenges, as you mentioned, particularly most of these servicemen and women have chronic pain issues. Not just, as you mentioned, they have PTSD or any, they're more moody, for instance, but they have this chronic pain. One patient that I have seen today, I saw him like 10 years ago for the same problem. Can you imagine that one?
Wow.
So yeah, because most of their pain that is not just like new. It's chronic that has been there for a quite period of time. That's why some of our students who rotate at the VA, we train them first on how to effectively. There's this what we call as therapeutic communication and effective communication with them, because we try to incorporate cognitive behavioral approaches, because it's a chronic pain that some of the patients will come to you. Let's say, I've been here many times and I just want my pain go away. They have wrong belief about their pain. They have this pain for quite period of time. I always tell my my students, how will you convince this patient right now who has this pain forever, that will not go away, but will be motivated to do whatever treatment you want to do for this patient. So that's one of the challenges that I can see, how to effectively communicate these approaches to our patients, how to change their thoughts and beliefs, how to effectively um, educate pain science to them, that actually, even with pain, for instance, pain is not always equal to harm. That's one thing that sometimes they don't understand. Sometimes they just want to have like pain zero. So but they have 20 years of pain. So how will you how what will be your expectation? I think those are the greatest challenge.
Wow, that's really good point to brought up. Especially we have many cases like that. It's not
Mhm.
only veterans, not
Yes.
only our aging and older adults. I
Mhm.
always remember when you have a trauma, especially the PTSD, it's like
Mhm.
they said that trauma is like a scar in the brain.
Mhm.
So that you cannot really remember, you cannot really forget about it because it's
Mhm.
like there's a high intensity of adrenaline and
Yeah.
neurons when it happens. So it's
Mhm.
like a scar. So maybe that also brought them with an increased pain, not
I agree.
really physically. And
Mhm.
I love that when you say cognitively, you put that into practice because how can we be an effective physical therapist if our client itself is not into it,
Yeah.
you know?
Uh-huh.
And that's really good. We have listeners here are very upcoming physical therapists from Philippines and also new physical therapists. You will really see these kinds of cases,
Mhm.
clients that really coming to your clinic or you're going to their
Yeah.
home but not into it.
Yeah.
So
Yeah.
communication, as what you said, Dr. Yul, is one of the wonderful techniques to brought up. Go ahead.
Definitely. Yeah. So it just reminds me my the practice way back in the Philippines. It's totally different. So we have to adapt as far as communication, as far as these different cognitive behavioral skills that we need to do. It's not just applying evidence-based practice of what kind of treatment, but also the way we interact patients, there's what we call Therapeutic Alliance, and that's a very important factor for success with our patients.
Oh wow, that's like that one. So Therapeutic Alliance.
Yes.
Okay. And also speaking of that therapeutic, also we have in evidence in motion in the
Yeah.
Academy of
Mm.
Physical Therapy. And we have this therapeutic pain specialist.
Science special
Yeah.
specialist
And
exam.
that's
Yeah.
really, really good. Imagine
Yeah.
they will teach you peripheral, like neurological, just
Mhm.
by breathing,
Yeah.
proper breathing in your, so that also helps in your improving the pain.
Yes.
So something like that. That's
Definitely.
wonderful. So I'm sure you read a lot of books and different courses. Share us, Dr. Yun, what are those wonderful books, even it's professional or personal development, or what are those books or courses that you feel that influence you to be an effective physical therapist right now in your practice?
um for me, at the moment, because I'm now in my subspecialty in OMPT, most of the books now that I'm into like reading are, like pertaining to the practice. Um, I have OMPT books. I like the one that is authored by Wise. It's called Orthopedic Manual of Physical Therapy from the art and evidence of different techniques that you can uh, you can apply into your practice. And the other one too is those journals, APTA journals, the GOSPT, the GMPT for IFOMPT. They release new evidences as far as what's best for a specific case. And even like just the general physical therapy journal of the APTA, it's a good reference. So I would definitely recommend to be a part of the association and subscribe those, because those are the greatest information that we can have updated on our knowledge as far as practice is concerned.
All right, that's a great tips, guys. So
Mhm.
if you're a beginner or not a beginner, you're working here, United States of America, everything now is accessible. So
Yeah.
everything is that's really accessible, the JOSPT, and read the OS article. The good
Mhm.
thing is that because you just subscribe and you can get all those articles even in Facebook. They have their group
Yeah.
page too,
Yes, definitely. They
and
they
they
uh,
link.
they they do put links. Yeah.
Yeah, they have a link, they have an article, and you can read some of them if you don't have them by hard copy.
Yes.
That's
Mhm.
really good. So, what are your wonderful tips that you can see? Let's say if you have the listeners right now, they are your client and caregivers. As a physical therapist, so what will be your tips to improve their balance, or what's the essence of exercise?
Yeah, so I was just actually looking in a specific review of a manuscript earlier, and I want to share this to all of you. This was actually what we call as the physical. I don't know if you have seen this already, Dr. Jen. It's the physical activity program for balance for fall prevention among elderly. It's
Oh,
in
wow.
2019 systematic reviews, and
Mhm.
we know that guys, balance is multifactorial, and it different kind of trainings is very important measure to manage. We all know that over time we decrease our strength, we decrease our coordination, particularly lower extremities, and so we also decrease our gait assurance and balance control, along with reduction of cognitive functions. Then there is increased risk for falls. So the one very important thing when we do something to manage it make sure that it's enjoyable. We enjoy what we are doing. And then it's multi-component exercises with mix of aerobic and anaerobic components, seems to provide positive outcome into it. um, Specific balance exercises integrated with resistance exercises is helpful as well. One thing that might be enjoyable, as I can recall, I was recalling about this, that we do in the Philippines, that some of our elders is doing is ballroom dancing. They enjoy ballroom dancing. Even like my aunt right now,
Yes.
she is 85 years old, but she's still like dancing and turning around. It's like, well, why is your balance good? I guess because of that. So that's very important. Along with that, and then specific lower extremity strengthening exercises will help a lot.
Right. I like that you emphasize that, Dr. Yu. I think I passed and read some of those articles before,
Mhm.
and
Yes.
you really pinpoint and nailed it down. Especially they have different kinds. So we have 150 minutes. They keep saying that it's ideal for you to have 150 minutes of exercise in a week for you
Mm.
to be physically fit, and that's the advice. And
Mhm.
then Dr. Yule emphasized majority of what are the different factors that help to improve your balance. And he added more on making it enjoyable. And I
Enjoyable.
totally agree. I keep emphasizing them that when we treat our clients, when I do even my client, it's very boring, very quiet. It depends. If they like music, if they like it a little bit, something like that, I ask permission. Can I just add some music so it's easy? Because the
Yes,
tempo is very, very easy,
definitely.
especially our clients, guys, with dementia and
Mhm.
early cognitive deficits. Music is being retained in their brains. So when
Mhm.
they have the music, it's easy for them, lessen the instructions.
Yes,
Just do what I do and then you dance together. And then
definitely.
you say that you love balance. Yes, so Filipino loves to sing and we also
Mhm.
love to dance. I think it's
Yes.
just automatic. So they said, Dr. Yule, you're orthopedic specialist, so I'm sure you know this. Body weight training and exercises are wonderful
Mm.
for the brain.
Yeah.
It improves the bone density. So we guys explain to our clients that weight bearing is very
Mhm.
important to improve their bone. And
Yes.
that's why dancers, they said, has the best bone density because of those dancing skills.
Yes.
So that's really wonderful and very great time to chat with you, Dr. Yu. So what's
Yes.
your advice for that's a wonderful tip as well and advice for our listeners. So how about your listening who are new therapists and looking forward to be in that kind of field? You check the OCS, like the
Mhm.
different
Examination.
articles.
Yeah.
How
Mhm.
about if they're being challenged right now with the different patients and afraid of different cases? So do you have any tips for that?
Yes. So the tip will be really based on my experience. Don't stop learning. Um, Physical therapist is one of the profession in medical field that is a lifelong learner. So every day is a challenge. There is always a new condition every day. Each patient may be the same neck pain, but they're not the same. They have different manifestations, for example. So we always have to be open-minded. We have to learn each day. We have to read. We have to be open-minded with others. Ask help if you need assistance. If you want mentorship, you can always ask people who have experience, and just pick their brains, like, what do you think about this, and what are your best suggestion in managing this condition, because that's how you learn, and that's what I have, my experience as well. I learned from that. I have good mentors before. I ask their help, I ask their opinion, and that matters a lot.
Yes, that's true. Mentor and coaches, and
Yes,
then be around positive people,
definitely.
Pe-
Yes.
people. Welcome to Philippines. Yeah. So I keep my husband always tease me with that fish and fish on the pig floor. Yeah. So by the way, guys, so thank you so much, Dr. Yule. That's really amazing. I almost forgot what I'm about to say because of that joke. And then I would like to give you guys, if you want a mentor and if you are looking forward to this kind of specialty in orthopedic, you can connect with Dr. Yu. He has wonderful resources as well. He has a wonderful Facebook page, Dr. Ulysses PTDPT, and that he always posts wonderful, like, evidence-based articles. He explained those things, why it's important, and I totally agree. Keep learning. Just check what improves you. If you've noticed, we have many client therapists that is looking forward. They have these different titles. Usually titles is just a bonus, but whatever you just get on top of that is what is important.
Yes.
Because what we got, I keep thinking, what we got is what we can give.
Yes.
You know, whatever new skills you learn, that's what you will apply to your clients. So it's not a de cajon, like what we call, right? So that's really good. So how we can connect with you, Dr. Yul?
Yes, so you can follow me on my Facebook page. It's Ulysses Juntilla. So you can just type the whole name and last name, and that's me. And then, or you can email me at ujuntilla@atsu.edu. Um, I'll be willing to, give my advice, mentor if you need help as well in the field of OMPT or orthopedic physical therapy.
That's wonderful. Thank you so much, Dr. Yul.
Thank you, Dr. Jen.
Yeah, you didn't correct me. I keep pronouncing it Juntilla.
It's
it's
actually
Juntilla.
Huntilia. It's actually Huntilia.
Oh, okay.
It's just a matter of like over time. It's hard when you say Huntilia and they always ask you to spell it. So
Oh,
I'll just say
yes.
Juntilla, so they will know that
Gotcha.
it's a J.
Yeah. That's why I thought I have a mistake. So thank
Yes,
you so much, Dr. Yul. We
you're
really
welcome,
appreciate you.
and
You're
thank you guys.
amazing.
Thank
That's
you.
amazing credentials. And we can really see that all the skills you delivered and you help a lot of our aging and older adults, especially our wonderful veterans. So thank you once again. So
Thank
guys,
you.
that's you're welcome. So guys, that's Dr. Yul, and you can connect with him in his Facebook page if you have any questions and want to be specialized in orthopedics and manual therapy. And also, you can also ask some questions, join us in balance and fall support group for decreasing your falls and balance, different articles. We can connect you to different physical therapists in your area. Dr. Yul is from South Carolina in Columbia. And we are connected also in Philippines right now, guys. So thank you so much for listening and have a wonderful day again.
Thank
God
you.
bless.
Have a great one.
You too.
Bye bye.